Thank you for choosing Singapore General Hospital, Centre for Assisted Reproduction for your IVF journey. As the treatment cycle will be a period requiring physical, emotional, and financial commitment, we encourage all couples to communicate and discuss openly with your spouse before coming to this joint decision to proceed with your IVF journey. This is what we will be going through in this video. At the end of watching the video, we will need you to submit a FormSG to CARE to confirm your decision before we coordinate your next fertility care plan. According to Singapore Ministry of Health guidelines, it is mandatory that you must be legally married before we start any IVF treatment. We will need to verify both your documents and also importantly, your marriage certificate before we commence any treatment. We will also need to conduct the mandatory screening and investigation tests as indicated in this table. Please note that the validity of these test results are of 6 months and you will need to repeat the test if any of your results are expired. Other investigations such as hormonal blood tests and ultrasound scans will be ordered for you during your day 2 to day 4 menses in order for us to better plan a program catered to your needs. After all these tests are completed, your clinicians will go through your results and the care team will decide on a treatment program for you. There will be a consent signing date given where you will meet your primary IVF clinician to discuss the treatment program, the success and risks involved. On this day, both husband and wife must be present to ensure a collective discussion and informed decision is made. The estimated duration of an IVF treatment will be around 4 to 6 weeks. The first stage of the IVF cycle is the stimulation treatment, which will last around 2 to 4 weeks, where daily injections will be required based on your clinician's order. At this stage, we will monitor the growth of your follicles by at least having 3 to 5 visits of ultrasound scans and occasional blood hormone tests. We will also need to check whether the follicles are responding to the medications and should there be a need to adjust them accordingly. If you are responding well to stage 1 stimulation treatment, you are ready to proceed to the next stage, which is stage 2 oocyte retrieval, which also means egg collection. Egg collection procedure is usually done in the morning, and on the day of the procedure, husbands are required to provide your sperm sample directly to CARE personally. For wives, you will be undergoing a procedure which will last around 30 minutes. You can be accompanied by your husband throughout, and you will be given sedation and pain relief medication. However, do expect some bleeding post-procedures. After the procedure is done, you will need to rest for an hour before our doctor assesses that you are safe for discharge. For your safety, you will need to be accompanied home. Next is stage 3, which is the fertilization of egg. Our embryologists will clean the collected eggs and sperms respectively and fertilize both gametes together. The outcome of fertilization will be informed to you by our embryologists 1 day after your oocyte retrieval procedure. Depending on the fertilization outcome, your clinician will decide if to proceed with stage 4, which is the embryo transfer. It can be carried out 2 to 5 days after egg collection, depending on the clinical decision. Our embryologists will inform you when the transfer be when it is nearing to the day. You will be invited back to CARE for the embryo transfer procedure, which will take around 30 minutes. The procedure is similar to a normal pap smear or intrauterine insemination. Husbands will be allowed to go into the procedure room to see the transfer. Usually, 1 to 2 embryos will be transferred depending on your discussion with your primary doctor during your consent signing day. If they are balanced embryos, you can then decide to freeze them in our SGH Care Lab at an annual storage fee for future use, or you can decide if you would like to donate or dispose them. Final stage is stage 5, where you will need to return back to CARE around 17 days after your oocyte retrieval procedure. Our nurses will then perform a pregnancy blood test for you to confirm the pregnancy outcome of your IVF treatment. We will then inform you the outcome once we have your blood test results back. For every IVF treatment, The success rate varies with different couples and is also dependent on the age of the woman. The possible risks includes multiple pregnancy, ovarian hyperstimulation syndrome, miscarriage, and infection. This will be discussed with you more in depth on your consent signing day with your primary clinician. If you have balance embryos that you would like to consider donating, please let anyone of the care team know and we shall run through the detailed donor program with you. Specifically for embryos donor, please note that there is an age limit such that the wife will need to be aged 18 years to below 38 years at the point of oocyte retrieval. It is a requirement for hospitals to report the IVF live birth data to MOH regardless of your circumstances, such as overseas birth. We will be collecting information such as your child's date of birth, birth cert number, gender, weight, and medical issues, if any. Should your delivery be earlier or your pregnancy end earlier than expected, we will appreciate if you can share the information to us at your earliest convenience. We will be contacting you if we have not heard from you. We have come to the end of the SGH Care IVF e-education video. Do submit the FormSG to confirm your decision and share with us any queries that you would like further clarifications on. We shall follow up and reach out to you for your next appointments where necessary. At Care, we strive to provide a one-stop service center and have a holistic team to support you in your IVF journey. We wish you well and we look forward to hearing and serving you. Thank you.